Good evening. Hi, this is Dr. Verdiales from the Georgia office. I hope that our friends down in Florida are keeping safe and that um, they are guarded by angels at this moment. And if they have to endure certain challenges in the next few days, that miracles come their way and the outcome is a lot better than anticipated. So today I want to expand a little bit on something I was discussing with our 40 plus fabulously young ladies on Monday morning. And it is about how we look at life and how we look at failure, because I think it's so relevant to the fertility world, especially in my 40 plus crowd. Um, when you think about how we look at life, and it's all about the perspective that you have, because if you imagine a child that is 2 years old and is trying to learn how to walk, um, and it falls, imagine how many times a 2 year old falls before it actually walks on its own. That's a lot of falling, that's a lot of failure. But that human still does not have these preconceived ideas of, I'm not good enough. This is a failure. No, the baby falling, it's another opportunity to make things better. So a baby falling, he doesn't or she doesn't just stop there, because failure is not a choice, right? It's not in the vocabulary. So that level of adventure and playfulness and almost being fearless, um, it's what we need to move through life. As we get older, we start losing that child inside, or I don't say that we lose it. It's more like it goes to sleep, we put it away, and we start having all this shatter in our heads, preconceived ideas of what success means, and then we put ourselves down. A loved one once told me that no just means next opportunity. It's a next opportunity to make things better. It's the next opportunity to rise up and, surprise yourself, because sometimes as we go through these failures, things are falling in place internally and externally. And then it's an opportunity to make it better. So you can look at the glass half empty, or you can look at the glass half full. You can see every challenge in your fertility journey as like the worst thing ever, like with doom, or you can take a breath and say, okay, it didn't work this time. What can I do to make it better? It didn't work the way I anticipated. Are we missing something? And so there's a way of looking at things as we go through life, not only, on the job scene, on our relationships, on our fertility journey, where you can see things through a pink glass. You can see things through a more positive view. And at the end, God's agenda will always be better than our agenda. We think that we might want things in a certain way. However, you never know what's lying ahead of you. Okay. Um, I have a I'm going to use this example. I've used it before, and it's a patient of mine that is, at the moment, she is the proud mother of triplets, but her journey, I've known her for 10 years. She has severe endometriosis, and she has taught me so much about life. You know, we started as a patient doctor relationship, and then it got blurry through the years because I would, I've done surgery on her for endometriosis and got to see her marriage grow and evolve, get stronger through the years. I've seen her becoming a mother through her stepchildren, and I've seen her endure all the challenges of having severe endometriosis, of having 3, 4 different surgeries, of having diminished ovarian reserve very promptly, as in an accelerated way because of her endometriosis. I've seen her go through 4 IVF cycles, fail after having IUI cycles, and finally, at the age of 42, become the mother of triplets. So, I joke with her, I'm like, okay, so it took you about 7 to 10 years to get here, which is normally what it takes an average woman to have 3 kids. You just did it in one big boom. So, but now when we talk, she it's very grateful to her journey because it allowed things to resolve. It allowed like marriage conflicts to resolve. It allowed her to help her stepchildren that had some conflicts with the mom. She ended up having them full time in her house. So she allowed to become a mom through her stepchildren, help them, and get her family ready to receive these triplets, to receive her biological children, her children. So when things are not going our way or the way we want to, it is human to feel sad. It is human to get angry. But take a breath, and as long as there is life, there is definitely hope. So you can see the glass half empty, or you can see the glass half full. You can see a failure as a big no, or you can see it as a next opportunity for success. Okay. All righty. So let's see some questions for the evening. So I have a patient who had her retrieval, and she's frustrated because it did not work. So there's many scenarios of why that happens. I had this discussion earlier this week with a patient that had she was very upset because through her monitoring she had 10 follicles, and at retrieval there were only four eggs retrieved. And so her question was, what happened with the other 6 follicles? And then she ended up having only 1 embryo. There's many factors involved. First of all, a follicle, it is at one point the recruitment of an egg, okay? However, the egg can disintegrate in the follicle, so it's pretty much an empty egg. It's an empty follicle. Or it could be damaged through the process of extracting it. There's nothing gentle about the extraction of the egg. It's a vacuum, and you're going to, puncture the ovary, puncture the follicle, and suck it in, and then take it to the lab. So all of that process in itself can damage the egg. And if it's frail, it could break, or in the process of recruiting, it could just die off, because that is what normally happens in nature. So when you are in your teens and you become regular and you start having ovulatory cycles, what happens is that at the beginning of the menses, okay, that's why we do baselines at that time, we count the antral follicle count, you get recruitment on both ovaries of a lot of immature eggs. Okay. And that's what the antral follicle count is that recruitment that normally happens in women. Okay. As the month progresses, there's going to be 1, max 2 lead follicles that will start suppressing the other ones. So it is natural for the other ones to die off. What we do through IVF is try to feed the eggs that will normally die off and rescue them so we can use them for, fertilization. But because it is natural for them to die off, there will still be some follicles that are going to be empty, and or they're going to be dying at the time of a retrieval. So even though it is extremely frustrating, and I cannot possibly imagine the emotions that go through, especially if you had to travel and you had to, um, you know, go through all of the expenses, that even though we are the most affordable clinic on the nation, it's a lot of strain emotionally, financially, mentally. It can happen. So, what can we do moving forward? Okay. Um, and like I was saying earlier, once the emotions settle, you can see this opportunity, this what seemed to be a failure, as an opportunity to make it much better, and look at how your body responded. Because IVF, all of this, all any of the fertility treatments, they're not only therapeutic, but they're diagnostic. Everybody responds differently. So all of the cycles, when you start looking at how you responded, how you started, what the protocols, they start kind of being shifted around, depending on how you responded and the speed you responded, and all of those things. We would have to look at your particular case and see, are we dealing with low ovarian reserve? Are we dealing with PCOS? Um, for example, sometimes PCOS patients do so much better when they do birth control the month before, because then you are able to manipulate the hormones to some degree to have a better baseline and have um, more even and more mature eggs on the next cycle. So see exactly what your scenario is, and so we can see this as a next opportunity for success. How successful is PGTM for genetic disease? Vary. PGTM, there's different types of genetic testing. So there's PGTA, which is for aneuploidy. That means they check on the chromosomes, make sure that they're paired up, and they can see if it's a girl or a boy, and kind of whether the chromosomes look normal or not normal. That's the most basic of the testing. And then PGTM is when you're looking for a specific genetic disease. So it will tell you whether it has it or it doesn't have it. So it's pretty specific. And in my book, that's one of the reasons that it's worth doing genetic testing, is like, if you have a known genetic disease, you or your partner, then it is worth going through the process of IVF and testing the embryos to do so. There's a lot of controversy around genetic testing on the embryos and whether it is even worth going through it, because there's a lot of gray areas. When the embryo is said to be normal, it is normal. However, when it's like mosaic, and sometimes even the abnormal embryos can self-correct and become a baby. So all of these other embryos that don't have a perfect grade might still be a normal baby. Also, a normal embryo does not guarantee a pregnancy, and there's a lot of controversy about damage to the embryo from the biopsy itself. After endometriosis surgery, how long should a patient typically wait to do an FET? It's going to depend on your particular scenario. For my endometriosis patients, I like them to split the process. So I like them to do embryo banking first, okay, and accumulate, as many embryos as they can, and they can afford accumulating, of course. And then if they can do surgery to manually clean it up, and then do suppressive therapy with Lupron or Lisa for at least 2 months. I mean, if the least would be 30 days, so somewhere between 30 days and 3 months, depending on how severe the endometriosis is, then that would be the optimal scenario for transferring, because even though your surgeon might have cleaned things up, there's still microscopic implants. There's still inflammation that's left over. So if we can get rid of it, it will be a much, much higher chance of success with an FET. Actually, the patient that I was mentioning, that ended up with triplets, um, she um, she failed her first, and she was doing donor eggs at the end. She failed her first donor egg transfer, and she had no visible, we did laparoscopy, she had no visible endometriosis. So we put her on Lupron for 3 months with add-back therapy. And then at the last month, we brought her in for baseline and she did her transfer. And then she ended up, it's a long story with her, but she ended up with triplets. Okay. Hello for everybody that's joining. Do you recommend to take Lupron prior to FET for patients with endometriosis? Absolutely. And Lupron is my drug of choice. Orlisa would be my second best. I know Orlisa, the benefit with Orlisa is that it's a pill. So if you have like brutal side effects that you can't stand, you can stop it with the Lupron. Once it's in, it's in. But you still can do add-back therapy with nortriptyline. Okay. Yeah, I mean, I think that endometriosis patients do definitely a lot better when they're suppressed for the FET. Okay. Yes. So yeah. So her story. I'll tell you her. I mean, I love that woman. So she came into my office. It's been a long journey. I don't know, she was like 35, and she came because she had just gotten married the year before, but she started having excruciating pain, and we found a huge endometrioma. That's how our relationship began. So we started from a GYN perspective. At that time, I was not working for CNY, but I started treating her endometriosis, and then she realized, oh my God, so that means that I should start trying to get pregnant, even though I had not planned to get pregnant right away after getting married. And that's where our journey began together. So we started with the letrozoles and the clomids and the laparoscopies, and I learned as much from her as I did. As you know, it was an exchange of information. One time, she showed me, like in the craziest of ways, the benefits of fasting. One time let's see, it was between her second and third laparoscopy. We found another endometrioma. She really did not want her ovaries touched, because with endometriomas, it's kind of like, you know, it's complicated, because you want to take the endometrioma, take the cyst from the ovary, but you don't want to take ovarian tissue. And most literature says if you don't take the whole endometrioma, it could be recurrent. But on the fertility world, you want to keep as much ovarian tissue. So it's like, So we found another one. She was scheduled for surgery. That was November. She got scheduled for surgery kind of at the end of January. And when I met her at the pre-op area, she goes, Dr. V, I have to tell you, I have no more symptoms. I have to share with you, I did something unusual, and you know, all the symptoms are gone. I was like, what did you do? You know, tell me. And so she said that with her church, like her church was doing the Daniel fast, so all January, but she took it to the next level. She did a green juice fast. I mean, that woman is my hero, because I don't think I can do that. She did that for 28 days, where it was the only sugar in her juice was green apples, but you know, celery, kale, spinach, and then she did that. Just that's all she drank. And I was like, wow. So she was already there for surgery. So I mean, I put the camera in her belly, and it was sparking clean. I mean, I was so shocked. I was like, "Oh my God." And I had been 2 times in her belly before, and I saw the results for the ultrasound a few months before, and endometriomas normally don't vanish. So I was like, "Oh my God." There was like no visible sign of endometriosis in her pelvis. I was like, "I'm fasting. I am so fasting." So after that, I mean, I did not do a juice fast. I think that we're so addicted to eating that it was totally psychological, but I did start digging into fasting after her. And then her journey continued, like I was saying, and she went through IVF, and of course, she was shaken at times, and she would come back, and a very resilient, beautiful woman. And finally she decided to, she was done. She was tired. I mean, this journey can be exhausting, and she discussed it with her husband. They were thinking about adopting anyway. They were just fed up with the whole process. They had been at it for so long, probably like 8 years. And so she decided to do IVF with donor eggs. But she wanted to go back to her country because she wanted her children to be ethnically like her. But she wanted to do monitoring with us. So we did her monitoring at CNY in the Atlanta office. So we co-managed with the doctor in her country. And like I was saying earlier, her first transfer, it was just a medicated transfer. We didn't do much, and he failed. And so we were all a little surprised. Remember, you can see a failure as an opportunity to grow, expand, and learn. And she was like, why? I mean, it's somebody else's eggs, so why did it fail? And so we sat down. I said, look, not because we can't see our endometriosis, you're not an endometriosis patient, so I'm going to treat you like you have it, like it's there. And so her doctor in the other side, we didn't communicate about how many eggs, how many embryos he was going to put in. And it was not crazy that he put so many in, because with her history, she was 41, all these failed IVFs and transfers, and first donor embryo transfer. He put 3 in, and of course, Murphy's Law. She texted me through Messenger, Dr. V, I'm pregnant. I was like, oh my God, she was super excited. And I was like, I bet they're going to be twins. I mean, with God's sense of humor, it's going to be twins. The next message I get from her is the ultrasound picture with the 3 sacs. So we walked that path together because I was still part of her healthcare team through her triplet pregnancy. And she delivered in May, and she's now going crazy with 3 babies of 3 months old and being a proud mama of her triplets. But yes, a lot of crazy stuff. So after her, she has taught me a lot of stuff, both information and just proof. I am a Lupron lover. I put her on Lupron for 3 months, and then on the last month, she transferred, and that's how that happened. All right. So subchorionic hemorrhage. Okay, so let's talk a little bit of subchorionic hemorrhage. That's very common in pregnancy. It is kind of a 50-50 with those, depending on the size of the hemorrhage. You can have where it reabsorbs, or if it's too big, unfortunately could cause a miscarriage. The treatment for that is wait, see, and pray. Sometimes it's kind of it's a tough spot to be, especially if you are on anticoagulation, like if you're on baby aspirin or the Lovenox. You can go down on it. I wouldn't completely stop it, depending on your scenario. And not because it happened once, it means that it's going to happen again. If it's a small one, most of the times the pregnancy will survive and the blood will be reabsorbed, but you have to follow it closely to make sure it clogs, like it becomes an organized clot, and then it gets reabsorbed. How long should I wait to start next cycle of IVF after taking antibiotic for 2 weeks for stomach bacteria? That's a very interesting question. Um, it depends on how you feel, honestly. If they found a stomach bacteria, I would encourage you to recheck, make sure it's gone. Two, I hope that you are taking probiotics to support your natural gut bacteria, the good guys, because you're killing the bad ones. But if you don't have your good soldiers on board, then you're going to end up back sick or with something else. And so I would check, make, if you're feeling good and things are back to normal, then, you can start IVF right away. Estrus priming, terrible headaches, what to do? Yes, estrase gives you brutal, brutal headaches. That's a toughie. So you can try to use your estrase more vaginally, try to bypass your gut, because what happens is when estrogen goes through your liver, it gets changed, the molecule gets changed a little bit, and it produces more side effects. So maybe, change to patches, change to vaginal estradiol for priming. That might alleviate the headaches. You might want to get some like baby aspirin, ice, um, and see if that makes it better. Sometimes the if you change the type of, you're doing estradiol, kind of change it around, even do estriol, and that's kind of more alternative medicine type of stuff, change the actual estrogen, might also improve your symptoms. Lupron use only with IVF. What about IUI? Great. Yes. Um, yes, because Lupron is going to kind of, Lupron and IUI, how do I answer this one? I mean, yes, you could do it, but you would have to have an IVF protocol. All right. And then you could do you could do a Lupron flare protocol depending on your scenario. And then that becomes like the Cetrotide. And then you can do it with the IUI if that's the scenario. Is drinking 4 to 8 ounces of plain grass-fed kefir? Yes, that is enough. Kefir is one of my favorite probiotics. It has 12 strains of good bacteria, including vaginal bacteria. For example, if you're having issues with your vaginal flora, you could put some plain kefir up the hoo-ha, and that should solve it. Is it take to take ibuprofen during stim? The Lupron is giving you headaches. The Lupron, for example, you can do add-back therapy, norethindrone, 5 milligrams to 10 milligrams a day. It really helps with all the side effects. You can take ibuprofen. There's this fear, if you want to call it in medicine, that ibuprofen is from the family of aspirin, and there could be a cross reaction, and there could be increased bleeding associated with it. It's in theory possible. I've never seen it, honestly. I've been a physician for 22 years, and I've never seen ibuprofen cause a bleed. All right. Well, very good. I am so glad that you joined me today. I know it was a little late today to start. I want to invite those of you that want to join us. We have a massive, wonderful celebration next Friday, the 7th, in the Atlanta area. It's going to be in a beautiful venue next to the river. It's called the V Celebration. You can call 770-266-0933. You can look it up in Eventbrite as well. We're going to celebrate the victory inside each and every one of you, whether it's in the making or it has been made, whether it's fertility or any other wonderful miracle that you were able to manifest, absorb, and accept. That's what it's going to be about. Dr. Kills will be there with us as our guest speaker. And if you are interested on discussing any further issues about your case, you can always message me through Messenger, and we'll make sure I'll make sure that my staff gets in touch with you to get you on my schedule. Otherwise, you can call the Atlanta office at 770-266-3930. The supplement side, it's 770-266-0933. Have a blessed rest of your week, and I will see you next week. Bye-bye.